You may start now, Abir. Jazakallah khair.
All right. Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah wa ala alihi wa sahbihi wa sallim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome and good evening, everyone. My name is Abir and I'm a peer counselor at Anisa Helpline, and I will be your host for today. Thank you for joining our 9th workshop in our series, Understanding Suicidal Ideation, in collaboration with Bell Let's Talk. Through our partnership, we're hosting a series of virtual workshops called Her Wellness Journey. These workshops are designed to improve Muslim women's access to social support, build self-esteem, and emotional well-being. Before we begin, a few housekeeping rules to ensure our workshop runs smoothly. Number 1, please ensure your mic is off so the session is uninterrupted. If you have any questions for those on Zoom, please use the Q&A window to ask questions to the host and panelist. We will either reply back to you via text in the Q&A window or answer your questions during the live. For those on Facebook, welcome. Please share your questions in the comment section and it will be answered during the live. And lastly, we will be sharing polling questions during the presentation to keep you engaged and help us understand you, your needs and preferences for future workshops. So be sure to engage in those questions. Now, without further ado, this evening we are joined by Sister Anisa. Sister Anisa has over 10 years of education and experience in psychology and counseling. She helps Muslim clients with their personal development from anywhere in the world via online sessions. Some of the concerns she addresses are anxiety, depression, mental health, spirituality, and identity, anger management, relationships, parenting, and family, among many others. Please join me in welcoming Sister Anisa. Assalamu alaikum.
Alaikum assalam. Thank you so much for having me. I'm just gonna go ahead. Is it okay to pull up the slides yet, or did you want to pull something else first?
Just before we pull up the slides, I will present the first set of questions and then we can get started.
Sounds good.
All right, so as I mentioned earlier, I will be launching a few poll questions. So we will give you 1 to 2 minutes and then proceed with the presentation. Thank you again for being here. Let me just start launching these questions. All right, so hopefully you all can see the poll questions. The first question launched on your screen. So how did you find out about us? Yeah, wonderful. I see responses coming in. That is great. If you feel uncomfortable responding, that is also okay. You're not obligated to answer them. Your replies will remain anonymous for those who are choosing to respond. So I'll give it another 10 seconds. All right. So we could just quickly share the results. All right, so a lot of you heard about us from social media. Some were recommended by a friend or family. That's great. And we have a few people through email. Great. All right, I'm just gonna launch our second question. All right, so hopefully you all are able to see our second question, asking us about the age demographics that we have here. I see some responses trickling in. That's great. Give you all a few seconds to reply. All right. Thank you so much for your responses. We do have like a diverse group here. That's great. And my last poll question before we get started. If you can share which province you are joining us from. All right. I'll give it another 5 seconds. Okay. So we do have quite a few people joining us from Ontario, Quebec, a few friends from Alberta and British Columbia. So that's great. Oh, we have Nova Scotia as well. Wonderful. All right, thank you for participating. Great, thank you for your input. And Sister Anisa, the stage is all yours now.
Thank you so much. I'm just gonna pull up my screen here in a moment. Okay, Assalamu alaikum, everyone. I'm so excited to be here with everyone this evening. Big thank you to Nisa Helpline in collaboration with Bell Talk for inviting me to speak on this very important topic of suicidal ideation. It's actually a topic that's very near and dear to my heart because, I believe that in Islam, to save one life is to save all of humanity, right? As the Quran teaches us. And so when we take the time to learn about how we might be able to help ourselves if we're struggling with suicidal thoughts or help somebody else who might be at risk, we're actually, honoring someone's life. We're taking the time to help them, to support them. If you yourself are struggling with this, today, I'd like to give you some tools to be able to cope with suicidal ideation, right? If you are somebody who maybe is a parent who has a child with suicidal ideation or has maybe even attempted suicide in the past, this presentation is for you. And I hope there will be something for everyone to take away from today's presentation, inshallah, in terms of tools and strategies. So we have a couple of objectives. We're going to talk about the origin of suicidal ideation. What are the factors contributing to suicidal risk? We're going to talk about ways to cope with these intrusive thoughts or urges. And then we're going to discuss ways that as a community, we can become allies for those who may be struggling with these sorts of issues. How can we support a Muslim that we know who is high risk individual? Before we continue, I want us to talk a little bit about the language that we use when we're discussing suicide. We really want to make sure that the language we're using is not shame-based. We want to make sure it's compassionate language. Unfortunately, there has been some terminology in the past that's traditionally been used that hasn't been the most accurate or the most helpful. So, for instance, one of those terms is committed suicide. Now, it used to be that, actually it was illegal, right, to end your life by suicide. And it was considered, something associated with murder, something associated with a crime. And society has gotten away from that now, from using this term committed, because we recognize it as a public health issue. It is a mental health issue. It is not a crime. And so when we describe it as we say committed, it's almost like you're saying this person is going to be, committed to jail or committed for a crime. So we want to avoid using the word committed altogether. It's better to say if somebody did, end their life by suicide, then say they died by suicide, they ended their life by suicide. But let's try to take that word out of the vocabulary so we don't further stigmatize this issue. The second thing that we want to avoid saying is this person successfully completed a suicide attempt. Well, let's face it, there's nothing successful about choosing to kill yourself, right? There's nothing successful about wanting to do that. Success is in, finding hope through the situation. We all may face at one point or another having these thoughts, right, of wanting to die. And for some people, it's a passing thought, right? And they're able to redirect it. And for other people, the thought may be very intrusive, very active, and it's much harder for them to redirect the thought elsewhere. So we just want to make sure that, again, we're using the correct language. We also want to avoid calling somebody suicidal, or even for yourself, like you might tell a friend, hey, I'm such a suicidal person right now. All I can think about is just wanting to check out of life, right? Let's not, we hear these terms, even mental health related terms. That person's so bipolar, right? If you see these people with personalities kind of run hot, run cold, that person is so bipolar. We want to stay away from defining people by a mental health related issue or disorder. We can say that they're struggling with suicide, they're struggling with depression, but people have the ability to overcome these issues. And so we want to make sure that we're not using these terms as labels. Okay. Very interesting statistic that some of you may have already heard about. This is research that comes out of Stanford University from Dr. Rania Awad's Muslim Mental Health Lab, and the research they're doing there. Great resources they're offering right now to the community. And they found that Muslims are actually 2 times more likely than other faith groups to have attempted suicide. And I'd like you all for a moment to reflect on this, okay? And again, I'm not saying completed suicide, I'm saying to attempt suicide. What do you think the reasons are in terms of contributing to this statistics that we see? What do you think that are the factors for why Muslims may be 2 times more likely than other faith groups? If you wouldn't mind typing some things into the chat box so we could just have a little bit more of a conversation right now. Some people are saying it's okay, someone's saying Islamophobia, right? Conflicting cultural values, for sure. Anyone else want to weigh in? Past sins, okay, yeah. There could definitely be some spiritual guilt happening, and depending on how you internalize that can be a factor. Abuse, stigma, yes. I'm going to pause for a moment here. These are all great answers, and they're all accurate, right? When we are looking at this issue, here's what we want to look at in terms of zooming out. When it comes to suicide, it is absolutely preventable, okay? And one very important statistic I want you to reflect upon is that the Substance Abuse and Mental Health Services Administration, when they collected their data, found that 90% of people who end their life by suicide have clinical depression or another major mental health disorder, and they tend to have some kind of maladaptive coping in terms of dealing with this, okay? Either, substance abuse, some kind of addiction. They don't have the tools in place to be able to cope with these challenges. They're probably not reaching out for help from a mental health professional. But what we've found, and the research indicates, is that when people with clinical depression or another mental health related issue get therapy or get on medication if necessary, 80 to 90% of those people respond effectively. And there's hope for that improvement. Here's the problem in the Muslim community that we're seeing, and that is that there's a lot of barriers to Muslims getting mental health treatment. A lot of the research is showing there's a mistrust that Muslims tend to have in counseling professionals. They're worried about discrimination. Someone mentioned Islamophobia earlier. Absolutely. How hard might it be, especially with what we're seeing happening in Gaza and Palestine and everything right now, to go to perhaps a non-Muslim therapist and talk about the trauma related to that? We worry, are we going to be understood? Are our faith values going to be respected? Right? So there's a lot of mistrust in that area. We see a lack of understanding about what therapy is and what it isn't, right? So it's not just somebody telling you what to do with your life, but it's a process. It's a process of developing self-awareness, self-insight, And it's not a quick fix. It's not, I mean, some people might be used to like going to a sheikh and getting an answer, right? Once or twice. This is a process. It's a journey. And so for some people, they may not be ready to do that kind of work. There's also fear of treatment. If I go to a mental health professional, are they going to make me take medication? If I am a college student, and I'm going to see a college therapist, is this going to get back to my professor? Is this going to affect my academic career? Is this going to be on my work record somehow? Right. So there's all these barriers that, and somebody mentioned stigma. Stigma is the biggest word, and compounded with Islamophobia. It's really difficult. So, there's a lot of other factors. Some of you mentioned it in the chat, right? So aside from Islamophobia and discrimination, some of the trends that we see in terms of what Muslims are facing involve identity crisis issues, relationship concerns, acculturation, right? Maybe you're might be an immigrant, or even having a family of immigrants, right? Who you might feel a disconnect from spiritually or emotionally, or maybe your values might be shifting and that's causing some conflict. There's trauma too. There could be some history of abuse, some history of PTSD, maybe from war, and the way in which family members might discuss these traumas as, this is just a test of your faith. You don't need a therapist. You just need God. That might deter a person from seeking counseling, depending on the narrative of how acceptable that could be in your family dynamic. And of course, addictions and maladaptive coping, we already talked about. So let's unpack some of these faith-based misconceptions a little bit more that might be contributing to someone who is suicidal or struggling with suicidal thoughts, or needing some extra help. What may be preventing them from getting in the door? Because there's a lot of faith-based misconceptions. I mean, the biggest one that we've always heard about is this concept of depression being a weakness of faith. There is no shame in struggling with a mental health related issue. All the clients that I work with, 98% of them are Muslim. And, 1 in 4 of us at some point in our lives is going to struggle with a mental health related concern. And there's no shame in that. Just like we might deal with a physical ailment, the brain is an organ as well, just like any other organ in the body. Sometimes we may have a genetic predisposition to depression. Sometimes there may be a trauma or a life event that we need professional assistance with. So the weakness comes from not from faith at all. It actually, people that are faithful are often the ones that are very introspective, that say, I need to get help. And they remember the ayah from the Quran that says to ask those of knowledge if you do not know, to seek, right? We need to seek professional help. Sometimes people say, well, prayer is the only solution. Prayer is just one aspect of coping. And I think sometimes we try to simplify mental health issues and say, well, if you just pray or you just do this one thing, you're going to feel better. And I'm going to talk about this later. But when you want to make shifts in your mental health, you need to focus on so many different facets, cognitive, mental, behavioral, emotional, environmental. There could be so many things that need to shift. And spirituality is just one aspect of our wellness. There's also misconceptions that, somebody might be affected by evil eye. Somebody might be affected by devil possession, and that's why they're having these thoughts, right? We hear these stories in the community that somebody might be envious or jealous, and that, it kind of puts some bad luck on me. Here's what I have to say on that. I'm not kind of dismissing somebody's belief system on that, but I say, do what you need to do. There's no shame to spiritually go and speak to a sheikh. And, a lot of times when people have a mental health issue, they're 90% more likely to go to their sheikh or imam instead of a mental health provider. I'm not saying don't go to those individuals. You can go and address it from a spiritual perspective. He might give you some ayahs to recite, some kind of du'as, prayers to consider, but also at the same time, it doesn't have to be either or all or nothing. also please go to a mental health therapist, because again, we believe, based off of the research, a lot of mental health issues have to do with chemical imbalances, could be the result of some kind of trauma. And we want to make sure that we're speaking to professionals who have the expertise to help us manage those issues. So, there's also this concept, I'll skip over a little bit just for the sake of time. There's a concept that people who end their life by suicide are going to go to hell. And so somebody who might be a Muslim having these thoughts may be feeling so embarrassed to even go to a therapist and talk about these things because they go against their faith beliefs. Here's the thing that we have to recognize is that there are people who have this passive suicidal ideation that maybe is always in the back of their minds. It could be part of the depression they're struggling with. And so it's an intrusive thought that they're able to manage. Whereas for some people, that thought can be very severe, very intrusive to the point that they're not sure they can keep themselves safe. And for some people, they may be so sick, maybe they're struggling with a very severe mental illness where there's psychosis, where they might become out of touch with reality. They might be hearing voices, seeing things that aren't there. That's not a person who's in touch with themselves, right? That's somebody who we say is very sick. And if a person is not in touch with themselves, it's very difficult to be in touch with Allah subhanahu wa ta'ala, correct? And so we should never judge somebody who has suicidal thoughts or is struggling or has ended their life by suicide, because Allah knows at the cellular level what somebody is dealing with and why they may have ended their lives and the factors contributing to that. And so let's leave the judging to God and be compassionate and show up for people who are struggling, and especially for families who may have had to deal with this. It's a nightmare for those people. They need our support. They need our help. So inshallah, we can bust these faith-based misconceptions that are out there so that we have more people walking in and getting help and support that they need. Looking at some statistics here, I know most of you are out in Canada. I'm in New York here, but we have to remember that suicide it doesn't discriminate. It affects people from all ages, all cultures, all faiths, all backgrounds. Okay, every year, approximately 4,500 people in Canada die by suicide. So that's about 12 people a day, and we have to remember that for every person that is lost by suicide, there are far more many people that have attempted, and those attempts don't always get reported, right? So it can be a much greater issue in terms of attempts. Every day, more than 200 people in Canada attempt suicide. That's a really big number of people. Here in the US, actually, college age is one of the biggest populations affected. It's the second leading death. Suicide is the second leading death among college age students. Every 15 minutes in the United States, somebody will die by suicide. So this is a huge public health issue. It's been on the rise, unfortunately, continues to be on the rise. Certain populations we've seen a decline with, such as Native American groups and other cultures, but for the most part, it continues to become on the rise. I just want to go ahead and ask a poll question right now. Are you someone that is currently struggling with suicidal ideation as a Muslim? And please remember, this is confidential. You're not going to, your name is not going to show up or anything, but I just like to get an idea of my audience if somebody here is really struggling with this right now. Okay, So we see that out of all the people we have here, we've got 38 participants right now. Okay, 19% are saying yes, this is something I've struggled with personally. And I thank you so much for sharing that, because I think we need to normalize that this is a spiritual, emotional, mental, physical crisis for a lot of folks. And so sometimes we think this doesn't happen in the Muslim community, but as you can see, there are people here with us today who struggle with this. My next poll question: are you somebody that's here who knows of a Muslim friend or family member who's struggling with suicidal ideation? Okay, see, that number went up, where 38% of people here say that they do know a Muslim friend or family member who's struggling with suicidal ideation. 62% do not, and that's okay. And you know what? I want to applaud you all for being here, because you are most likely going to meet somebody at some point who is having these thoughts. And I think whether you yourself are going through it, or you may come across a coworker or someone at the masjid who's dealing with it, this is such a great opportunity to figure out how to help them. And I'm going to talk about ways that we can do that, inshallah. I'm going to just skip a slide right here. But, again, suicide, we want to make sure we understand it's everybody's business, okay? Even if you haven't struggled with it and you say you're never going to go through it, I can tell you that for a lot of people who are the ones that eventually walk into that therapist's door, it's because somebody like you or I, somebody who may just be a friend, a coworker, recognized the signs, saw the signs there, and said, "Hey, I really want you to get some help," and planted that seed. And so we all play a very integral role as first responders, as gatekeepers, and getting people the help that they need. And we're going to talk more, inshallah, about what that help looks like. Okay. We went over some stats already, so don't want to spend too much time on that. But one thing I do want to point out is these are the signs of clinical depression. Okay. The biggest two signs is someone who, in addition to having persistent feelings of sadness 2 weeks or more, loses interest or pleasure in usual activities and things that they enjoy doing. Keep in mind that, that somebody who may have just lost somebody, a loved one, is going through a grief process, they're going to be sad, right? It's going to be situational depression. But over time, even those situations could result in more long-term depression. And so if you're seeing these two things, and then any changes, significant extremes in appetite, in weight gain or weight loss, in energy, feelings of worthlessness, a big one is just feeling like there's no hope for the future. Somebody really kind of having that doom mindset that nothing's going to get better, nothing is going to improve in my life. These are the signs that, somebody might be struggling with suicide. In fact, as therapists, we are trained that anytime somebody comes to us with clinical depression or signs of depression, we always want to also assess for suicidal ideation as well. So please keep in mind that these signs of clinical depression, they do go in hand with suicidal ideation. And as we talked about earlier, most of the time, people who are ending their lives by suicide have a multitude of factors resulting in them considering suicide. So it's not just a mental health issue, but maybe they're having financial struggles. Maybe they just lost a loved one. Maybe they lost their job. Maybe there's some kind of trauma they just experienced. It's never just one thing that makes somebody want to consider suicide seriously. Okay, I know sometimes people like to blame it on like, oh, this person broke up with someone, or their engagement broke off, whatever. It's never going to be just one reason. So let's keep that in mind. Okay, so yeah, let's bring it back to this. There are a few people with us today that are already dealing with suicidal thoughts. So how can we cope with those thoughts? And then even maybe people here or who may listen to this later who have attempted in the past, how do you heal after that? Okay, so first thing I want to mention that's very important is I worked with Anisa Helpline and Bell Talk to help create a suicidal ideation toolkit. And inshallah, for everybody who's registered for this, they will receive the toolkit after the session, but I'm sure you'll also be able to find it on the website as well after this. And I really recommend that you have a good look at this. They did a wonderful job of putting it together with beautiful graphics, really clear, easy to understand. But when you are trying to cope with these thoughts, okay, prevention is always the best intervention. We don't want to wait until the depression peaks or the suicidal thoughts peak to then start taking charge of our mental health, okay? Just the way you would manage any other mental health issue and the way that you would foster positive mental health through self-care strategies, those are the same things you want to focus on with suicidal ideation, okay? So what you want to do is you want to look at the cognitive changes. You want to look at and this is something a therapist can help you with so much, especially if you find a cognitive behavioral therapist. They're very good at helping you sift through automatic negative thoughts that could be contributing to the suicidality, right? Helping you challenge those thoughts, filter through unhelpful thinking patterns, helping you reframe thoughts in a way that's serving you, in a way that will help you kind of get out of that fog. So you want to make sure you're addressing it cognitively. In the toolkit, I also talk about emotional tips. You want to make sure that you are really able to sit with how you feel. There's a lot of emotional avoidance that I think we do as a culture, a lot of numbing. If we're feeling a certain way, we want to just check out of that right away. We want to hop on social media. But actually, the key to emotional regulation is to feel what you need to feel and to give yourself some space to do that so that you can regulate it. So emotional avoidance will really be your worst enemy when you're dealing with suicidal ideation. You also want to look at behavioral ways to manage. So, thinking about creating a holistic routine. Again, going back to the toolkit, I've included in there a self-care assessment. Please take the self-care assessment and look at it. It just beautifully gives so many different ways that you can focus on self-care and see what you might be lacking, what you might need to do more. That prevention-based self-care is going to be incredibly important. So as you're really scheduling your urgent important tasks during the week, please make sure you're making time to balance your mental health as well. Okay. And with suicidality, there's a couple of other things you want to consider too that are a little bit different from other preventative measures you might take. And that is one, you want to make sure that you are safety planning. Okay. So if you have a therapist, that therapist should be safety planning with you after every session, checking in to make sure everything is okay, that there's no imminent risk, that you've got a plan after you get off that session to be able to manage whatever intrusive thoughts or urges you might be having, okay? And I've included in that toolkit a safety plan sheet so that, you don't even have to wait for a therapist. You have that sheet and that resource and you can reflect on your own how to safety plan. Okay, so please, utilize that. And the other thing to consider is lethal means, and making sure that you've identified all the lethal means you might be considering in terms of ending your life, and then making sure they're not accessible. So making sure if you have a family member you trust, that they hold on to whatever those means might be that you are considering until you feel that you are safe enough. Okay. So those are some things you want to consider. Again, please have a look at the toolkit. It's got a lot of helpful tools for how to manage. How can you help somebody who might be struggling with this? Okay. You suspect, you're seeing some signs that we mentioned. You suspect there might be something there. Okay. First, you want to make sure you find a private place to talk to them. Please do not stage like an intervention with a lot of people, or put them on the spot in a large group. Find a private place to talk to them, pull them to the side, and say, like, I've noticed and I've observed some changes in your behavior. I've noticed you don't seem to come out to the mosque as much as you used to after your last, I don't know, divorce or breakup or whatever it might be. I just want to check on you. Are you okay? What's shifted for you? Come as from a place of curiosity. Express what you're observing. Use I statements. You want to avoid saying, like, you've been really like you seem I mean, you can say, like, you seem not yourself, but you want to avoid saying, like, using a statement that would be shame based, right? Like, you're so depressed lately, or you're so this. Again, we won't want to label the person. Okay. And we want to spend a lot of time listening to what the person's going through. And I think this is really hard for most people, to just sit and listen. But I'm going to tell you, this is the most important part of the process in helping somebody. Is, please, if you can spend 10, even 15 minutes listening to somebody, what they're going through. I mean, hopefully it wouldn't be that long, but sometimes people might need that depending on all the factors contributing. Let them speak. When they feel understood, when they feel you've heard them out, then they're going to be a lot more likely to be open to suggestions down the road. But a lot of times we want to jump to giving those suggestions right away. So listen, don't lecture. Please don't be shocked. Watch your body language. We don't want to be like, oh my God, I can't believe you're thinking of ending your life. Oh my God, that's so haram. Like, and then you just shut that person down. Okay. So we want to make sure we're composed, we're listening. Most people want help. Okay, so you don't have to become reactive when you're saying this. Majority of people who are going through this, they want help. So at the end, you explore those resources with them. Talk about Anisa helpline, talk about the 988 suicide prevention lifeline. Maybe they're not suicidal, right? It's not always about that. It's about maybe getting them some therapy, looking at the different tools, and help them come up with a plan. So that's part of safety planning. Just a quick poll question here. What do you think? Do you think it's recommended to ask somebody directly about suicide if you think that they might be considering that? Do you think it, or might it, like, put the idea in someone's head? Okay, interesting. The room is a little bit split, huh? There are some people, 46% say yes, 54% say no. So it is actually recommended. that you ask directly about suicide if you think someone's considering it. You're not going to put the idea in their head. And I think that's why a lot of people are fearful about asking the question, because they worry what's going to happen if they weren't considering it. Now I give them the idea. Okay. Nobody was just born yesterday. Everybody knows about suicide. It's crossed everyone's mind at some point. Most people will be relieved if you actually address it head on. And if somebody's making statements like, I just don't see any hope in the future. I don't think things are ever going to get better. You really have to say, when you're talking about things like this, it almost sounds like you're mentioning or considering suicide. Is that something on your mind? Don't be afraid to ask the question, because you might save their life. And that person will be so relieved that somebody acknowledged it, because it's been on my mind, right? And for all those who are here, we've got to remember, suicide is a permanent solution to a temporary problem. Okay. When we are seeing people who often are thinking about suicide, it's because they're trying to take back some kind of control over situations they feel they have no control over. And we've got to be reminded that all problems are temporary. Everything is temporary, right? Except Allah subhanahu wa ta'ala. That's the only constant, the only permanent. And so we have to remind ourselves of that. So just real quick, some resources as we're wrapping up here. Suicide Prevention Lifeline for those, anyone in North America, excellent resource. You dial 988 and 24/7, there is someone, a crisis worker, ready to answer the phone and help you. And this is not just for people who are suicidal. Can just be somebody who's having a really bad day and needs someone to talk to. Okay, but if a person is suicidal, this is a resource that can be life-saving. It can connect them, if needed, to emergency personnel who can help dispatch them to the hospital if needed, so that they can get the help that they need. Okay. And I'm not saying every call is going to result in that. They're trained in safety assessment and all that. But if needed, it's a life-saving resource for many people. And I actually used to be working for them. So I used to answer the calls, and it's amazing service. Also, we have Anisa Helpline, which is, a little bit different in terms of being a warm line, not a crisis line, but still very useful. You may be, somebody, in terms of this topic of suicide, you may be somebody that you don't want to act on the thoughts, but maybe the intrusive thoughts are there, and you just want somebody to talk to help you figure out ways to cope and ways to distract. So a crisis worker from 10 a.m. to 10 p.m. will answer for you. Now, Anisa Helpline is for women. The other 988 number is for everybody, right? Male and female. But what's unique about Anisa Helpline is they have a database as well with a lot of resources for Muslims, maybe ones you haven't considered as well. So maybe you're also trying to find a therapist in your area. They can help you with those sorts of things, as well as a lot of other issues. So I really recommend you save the number in your phone. Lifelines and crisis lines, they can be a great coping strategy to help you when you're having a hard time, as far as a coping mechanism. And I meant to mention earlier, but that 988 number, Canada has also developed their own system as well, using the same number, 988, the same protocol, same model. So you can feel free to dial that in Canada as well. Just before we go into the Q&A, here's some mental health resources we have available that I highly recommend. Another thing to keep in mind is we have mental health first aid trainings, suicide prevention trainings. Maybe you want to consider telling your local masjid, hey, I'd love to see this offered. If you're a student in college, hey, go to your counseling center. I'd love to see these trainings offered so that I can learn more about how to save a life, just like we learn about CPR. It's great to learn how to save a life when it comes to suicide and mental health. Wrapping up here is a little bit about me. I have a website, if you'd like to get in touch, anisadiab.com is the best way to reach out to me. I work with clients all over the country. I offer online sessions. So if you ever feel that you want to reach out to me for appointments, or you have any questions at all that might come up after this webinar today, please feel free to reach out.
Jazakallah khair, Sister Anisa. I hope you all enjoyed this amazing presentation, because I definitely benefited a lot. I really learned some key tips and lessons that are super valuable. So Jazakallah khair for sharing all of that. We now have reached the Q&A segment of our session, and we have a few questions for you. So if you're okay, I can start off with the first question.
Bismillah, yeah.
So we got a message from one of the attendees. She says, I'm a mental health worker. I sometimes feel nervous working with a client with suicidal ideations or past attempts, because I fear they will I believe, contemplate it, especially if I say something that does not sit well with them. I know a lot of therapists feel this way. What is your take on this? How can I work on this?
Yes, this is a great question. And when I used to work for the Suicide Prevention Lifeline, like you, we would get calls from therapists, guidance counselors in schools saying, I have a student that is struggling with this ideation. I'm not sure what to do. So I think this is a specialized area we need a lot more training in. And unfortunately, there's a lot of people that they just don't, they may have not had enough training in graduate school or enough experience in their internship program, having had a client who maybe needed to be admitted to know what to do in that situation. So if you are a mental health professional in this field, please talk to your supervisor and say, I need more training in this area. I'm not feeling that confident. Can you please organize a safe talk training for us therapists so that we know how to handle these situations a little bit better? And if you go to the American Foundation for Suicide Prevention, their website has information about how you can access those trainings and hire people to come out and do that for your group. Even in a masjid setting, right? There's mental health first aid trainings, for imams and chaplains and things like that. So please get extra training in this area. It's not something that you kind of come out of grad school knowing. You really do need to do some further study on this, inshallah.
That's definitely important, like having that support system and that professional development for mental health professionals to continue building on those skills, definitely. And we have a similar question. It is, what if clients do have a plan, but do not share with you due to the limits of confidentiality?
What if, is that coming from a mental health professional asking?
It seems like it's coming from a mental health professional, because you're asking about clients.
If they have a plan, but they're unwilling to share it, that is problematic, because if they have said, so when you are asking a client about suicide, you're asking three big questions. One, are you thinking about it? And if the answer is yes, the next question is, do you have a plan? And if the answer is yes, then you have to ask one more, and that is, how are you planning to do this? And if they can be specific about that plan, and they're unwilling to safety plan, and they're adamant that I'm going to leave this session and still do this thing, then they're not allowed to leave until they can commit to their safety. Otherwise, that person could leave the office and do something right away, to end their life. So in that situation, the client, there are limits to confidentiality when it comes to someone who is not safe, right? If somebody comes into the session and says, I'm going to kill my husband when I get out of here, they're not leaving. Okay. If somebody comes in and says, I'm going to leave this session, but I refuse to keep myself safe, they're not leaving. So until they can commit to their safety, they're going to have to go to the hospital. So that's a point in time where you want to get your supervisor in the room. You don't want to be alone having that conversation with the person, and you want to make sure that you're close to the exit door just in case. This is a big safety issue, not just for the person in the room, but for the person also helping the individual. So please get specialized training and make sure your supervisor knows when that happens in session. Yeah, somebody's saying they would require hospital admission by Canada by law. Yes, they would.
Thank you so much for that. I just wanted to check in and see, do we have time for maybe one more question? Maybe we can ask one more question. Yeah, okay. So are people that attempt suicide more likely to try again, or do they seek help once they were that close to that?
That's a really good question. Yes. So if someone has attempted suicide in the past, the research shows that they are more likely to repeat it in the future. And that's why when you're doing a suicide assessment, it's interesting. I have a lot of mental health providers in the room. When you do suicide assessment, and again, somebody says, I'm depressed, or I'm dealing with thoughts of hopelessness, and you're asking questions you do want to ask, have they attempted in the past? Because then that increases how high risk they are. If they have had the capacity to do it before, it means they have the capacity to do it again. Now, at what point does that person go and seek help? It's a little bit unclear, how after how many attempts on average somebody would go in and get the help that they need. And it also depends on when they attempted, did they go to the hospital? Did they follow up with a mental health provider? I hope that they do. And I hope if you have a friend or someone who said that they've attempted last week, these conversations happen among kids at school. They'll tell their friend, hey, you know what? I tried to do this last week. I tried to hurt myself and my life. And their kid doesn't know what to do with that. They need to encourage that person to make sure they tell their parents, they follow up with a mental health provider, because at that point, it means that the symptoms are severe. It means they're severe. So I hope that helps.
That definitely helps me understand. Like, it's really important to look at what happens after that attempt, what measures have been taken.
Yes.
That's a really helpful thing to keep in mind. We do have another question that came in.
Sure.
What do you do when a client who left the hospital because of an attempt? Sorry, what do you do when a client who left the hospital because of an attempt and tells you in office they faked their well-being to get out of the hospital, but that the ideation is still there?
That's interesting. That's really interesting. And that will sometimes happen. And I think you have to really, there's no hard and fast answer for that, because I have a lot of follow-up questions on that. You've got to ask a lot. What was the referral process? Are they now, they're not going to let her leave the hospital, him or her, until there's a safety plan in place. And that safety plan will involve, either maybe some regular appointment with a psychiatrist or a support group or a medication follow-up. So we have to always go back to the safety plan. Okay. And we have to determine how imminent is the risk now. Okay. So this person, even though they're saying I faked it to get out, they're not going to, once you're admitted, by the way, they will not let you out. Like if you go into triage and you say, I'm here because I'm having suicidal thoughts, they're not going to let you go after that. Like once you're admitted, they're going to do a thorough mental health evaluation. They're going to help you see a provider that can help you determine the next steps. People, they look at these movies, they get scared. They see people in straitjackets and they think it's like some kind of prison. Please don't look at the movies. Okay. This is you getting help. You're going to the hospital so that a mental health provider, someone's saying they only hold you for 72 hours. Yeah, it depends. I'm not sure, if there's a difference in Canada versus the US, but they're going to hold you at least overnight, at least 24 hours. I know that's for sure. So, I've had clients that have said, oh, I went in and I changed my mind and I tried to back out. They're not going to let you go at that point. But, eventually they're going to release you within 24 to 48 hours. It's not always true. I went to the ER and they only kept me for a few hours. Okay, Aisha, where are you located? Are you in Canada or the US? It's interesting. So there's some people with mixed feedback. I went to the ER, they only kept me for a few hours with that. It's going to be different for every person. US. Okay, interesting. Different hospitals may have different protocols. My understanding is majority of the time, from what I've heard from my clients and what I understand to be the protocols, they're required to keep you overnight. Okay. So yes. And okay. Anyway, so safety planning is key. Safety planning is really key. You want to make sure that regardless of what happened at the hospital, you're asking the question, okay, I understand you said what you needed to get out, but what steps are you going to take to make sure that you're keeping yourself safe here and now? Okay. And that's the key. So you're going to follow that in the toolkit, there's a safety planning resource, and that's what that would be great for mental health providers that are here. They can utilize that resource.
For sure, 100%. And that will be emailed to all the participants and registrants. So you can keep an eye out for that. We do have another question. Can a child as young as 5 present suicidal signs? What should a parent look out for?
That is a really good question. That is really young. And the answer is it is possible. It's unlikely at that age, for it to be, it's not as prevalent. It's definitely unusual. But it depends, what they could have been exposed to. What a friend or peer or somebody might have watched something that was inappropriate. You never know. But it could be possible. And my recommendation is, when it comes to children, you really want to get them in with a psychiatrist as soon as possible. If you suspect that there could be some suicidal ideation in a 5-year-old, that there's a lot going on in that 5-year-old's life, and it's not about them. It's about what's happening around them and their family dynamic, most likely. So it's really important to, as a family comes together, get some family counseling, have a psychologist who can really ask the right questions of this 5-year-old with the family present, and even without, some moments without, to make sure that everyone's on the same page. And, sometimes kids don't understand the finality of death, right? Like when a 5-year-old thinks about the concept of dying, they might not understand the permanency of that, right? So a therapist, good one, can help understand, like, what do you mean by suicide or wanting to end your life? What do you think that looks like, or what do you think that would mean? So I think as a parent, you can ask that kind of question. What does that word mean to you when you say, I want to die by suicide? Or what does that mean to you when you're saying, I'm thinking about ending my life? What do you think the consequence is of saying something like that? So that, I think, approaching from a place of curiosity is really important, to first get clarification on the child's context and understanding of that. We're not.
Yeah, Abir, are you online? Just wanted to check in. I know we're at 8 o'clock. I know there are a few other more questions coming in, but we just wanted to check about your comfortability going on for another 5 minutes, or can wrap it up, inshallah.
I'm totally fine with it, if Abby it is.
Okay. The other question we have is, how do we differentiate between not being afraid of death versus suicide?
Interesting question. The difference, it's very interesting because when you look at someone who is having suicidal thoughts, you can say about this person that there's a detachment from the dunya, a detachment from this life, right? And within Islamic understanding of death and preparing for death, as the Holy Prophet, peace be upon him, he said, "Mutu qabla an tamutu," die before you die. And what does this mean? It doesn't mean go and die and take your life, but it means, develop a mindset in which you're detached from the dunya and you're ready to face God when that time comes, right? And you've done the necessary work, the soul work in this life, the relational work to, inshallah, pass the trials that one is facing. The difference with suicidality, again, depends on the level of severity. For some people, it might be mild, right? And just they're able to cope with it. It comes from time to time, these thoughts when their depression peaks, perhaps, but it's mild. For some people, it might go between mild and moderate in severity. And those people may struggle a little bit more with not wanting to think about what kind of plans they're going to make. But when somebody is seriously contemplating suicide, it's at a point where, again, the ideation is there, the plan is there, and they have a very specific way of how they're going to do it. And that how you're going to do it, and that imminency and, I guess conviction is the word, in wanting to do it and actively taking steps to end your life is what's problematic, right? Because, the belief is that in Islam, God is the one that takes the soul, right? And so, a person who is, again, it depends what the person is going through. They might be in a moment of psychosis or what might have you, that they're not able to even connect on a higher level with that, but the person is taking active steps to end their life. And that's the difference, is that as Muslims, we want to strive to make sure that we're recognizing that we're in this life, and there are going to be times where, we don't feel like being here, maybe. Like, life is so hard. We're going through so many problems. I just feel like checking out. But guess what? There's a big difference between wanting to check out of life and wanting to check out of the pain, and wanting to check out of the problems, and wanting to check out of what's stressing me out. Okay, we all have moments where we're like, isn't this enough? Like, I'm facing one trial after the next, And so it's normal. Sometimes we might say, Ya Allah, I'm ready for you. Whenever you want to take my soul to you, take it. But that's a big difference in mindset compared to somebody who's saying, I want to check out of this life because I can't see any more hope, and I can't see that things are going to get better, right? That's a person who's lost sight of themselves, and again, just holistically, kind of the bigger picture in terms of their mental health, in terms of, again, the permanency of issues. And again, like I said, suicide is a permanent solution to a temporary problem. We have to recognize all problems come and go. But when a person decides to take their life, if they think they're checking out of the pain to people that love them the most, they're transferring the pain to their communities, right? That energy is not going to be destroyed when you decide to take your life. It actually gets passed to the people who love and care about us the most, and it affects communities. And it, sometimes you see this contagion happening where, a friend might have lost a friend to suicide. Now they're considering it. You see these contagion suicides, what we call. So keep that in mind. You're not doing anyone a favor by checking out of this life. You're just transferring that pain. So, for anyone who's struggling here, please hold on. There's so many people that care about you. I know I might not know you personally, but I'm doing this work that I do because I believe every soul is important. and God created you for a reason. So please, hold on. Don't give up. And I can promise you, I've been through a lot of problems in my life, but life does get better, and it will get better, inshallah.
Thank you so much for sharing that, Sister Anisa. I think that point you mentioned, there's a difference between checking out from pain and checking out from life. I think that's something that I will hold on to for a very, very long time, because it really, really, really stuck with me. So thank you for sharing that. We will wrap up, but with just one last question, if that's okay.
Yes.
Okay. So there's a question that came in. It says, what do I do if someone I care about confided in me his suicidal ideation or plan, while refusing to seek help or inform their family or anyone else?
Mm-hmm, mm-hmm. Yeah, so if somebody has a plan and they're confiding you in that plan, and they say, this is what I'm planning to do, you need to follow up, okay? Actually, is it okay if I share my screen for a minute for that question? Because I think this will be helpful.
Yeah.
Okay. Oh, I'm still sharing anyway, so alhamdulillah. Okay. Yeah. So these are the 3 questions you want to ask someone who's suicidal. You take a picture, screenshot this, okay? If somebody is at that point where they're telling you they have a plan, you need to ask another question now, okay? Because every time they say yes to these questions, then the risk keeps going up. So you have to ask, when are you planning to end your life? And if they give you specifics, like the more specific they can be, obviously the more urgency goes up. And anytime someone has a plan, it's very concerning. But especially when somebody says they have a time frame for it, then it's more alarming. And then the last question you ask is the means, like what are they planning to use in order to end their life? The more specific they can be, the worse it is. And then you ask, do you have that on hand, whatever you're planning to use? And again, if they're very specific about that question too, some might say, like, I mean, I used to answer calls where somebody'd say, like, yeah, I've got this item here I'm planning to use on myself, or and I'm ready to use it like right now, and I'm waiting for you to give me a reason to live. And that's a situation where you call 911. You have got to stay with that person, like, if you can stay on the line with them. I don't know if it's on the phone, or if you can call somebody, to call 911 on their behalf. I mean, it ideally would be recommended that they go willingly to the hospital and get some help. But again, it's just to give them, to make sure that they are not going to harm themselves imminently, and have the supports that they need, and get the proper diagnosis and possibly medications they may need to get help. But you definitely don't want to keep that kind of thing a secret. You don't want to kind of worry about betraying somebody if you call 911. And it's also okay, if you're not sure what to do, to utilize crisis lines, okay, like 988, and say, like, listen, I've got somebody I'm really worried about. Sometimes we don't even know much about the person, right? And maybe we just have a phone number. I know not like Suicide Prevention Lifeline, they can do checkups on that person. But again, you don't want to rely just on that. You want to know the skills and the tools. So, this is kind of, again, the model of questions you want to ask to determine what to do. But if a person's not willing to safety plan using the resource in the toolkit that we've provided, then it really does mean that they're not safe, and they need immediate help, just as if they've had like a heart attack or something like that, as if they've had a heart attack, right? You wouldn't refuse to call 911 for somebody who's having a heart attack. This person is severely at risk at that point, and you got to make the call. So every case is going to depend. It's about asking the right questions and figuring out, is this person willing to keep themselves safe? Are they willing? They're feeling this way, but are they willing to set up an appointment with a therapist and get help? If they say yes, then that means there's some hope, and they're not wanting to act on the thought. They might be feeling this way right now, But if they're willing to keep themselves safe until they get to a therapist or whatever, that's safety planning. Okay. So it's just really going to depend. And every case with a person can be so different.
Thank you so much for sharing all of that. It's definitely a difficult topic and a difficult situation to be in, but for sure, like, we're walking away with a lot of tools and lessons that you have shared with us today. So Jazakallah khair, Sister Anisa, for answering those questions and for the great presentation. It was a pleasure to have you with us this evening. For all those who registered on Zoom, you'll be receiving a self-help guide created by our speaker in your inbox soon. And for those who did not register, you can access the resource guide on our website, nisahelpline.com/wellness. It will be shared in the chat. Before we wrap up, keep an eye on nisahelpline.com/wellness or our social media platform, which is at Nisa Helpline, to watch our previous workshops or download free mental health resources. Thank you all once again for joining us this evening, and thank you once again, Sister Anisa, for walking us through that. Assalamu alaikum, everyone.
Thank you so much for having me. Wa alaikum assalam.